Hey, it's Dr. Gigante, founder of the Back Pain Center and author of Hope and Help for Back Pain. So we're going to talk about the hip hike or exercises you can employ to correct the sacroiliac joint dysfunction. We talked about that, and that's where the pelvis kind of goes out of place. So the exercises we're going to be looking at right now are corrective. The classic is what is known as the hip hike. But sometimes that doesn't work, and sometimes you need to modify it. So we're going to look at the different ways of modifying. The classic hip hike should be done on the long leg side. However, since you're not going to be able to check that, I would suggest doing the hip hike on the painful side only. The hip hike is where, so if this is your painful side, typically the SI is going to be right in that area here. Sometimes it goes into the groin, in the front of the leg here. But what you can do is you're going to bend your leg here, and what you're going to do is you're going to think of pushing, you're going to lift, and you're going to pull, you push your knee forward. At the same time, you're going to roll your pelvis that way. So you're going to create distance between your belly button and your kneecap. So go back down, okay? So up, so you can see that this gets wider. This tends to go that way, and the knee goes that way. You want to do this, hold it. While you're up here, hold it for 5 or 6 seconds, and then go down. This one here typically will be of all the things I'm going to show you, this is probably the one that's going to work most of the times. However, you sometimes need to incorporate other things to help this along. One of the things you can do if you say, hey, it's still hurting, is you can bring the knee up again on the painful side, put your legs around it, and what you're going to do is you're going to try and break through your grip. So your hands are going to pull, at the same time your leg is trying to break through. And this is called an isometric exercise. And again, you're going to do it. Hold 1, 2, 3, 4, 5, and then relax. Pull, yeah, relax, pull, yeah, pull down. So So it's hard to see him doing it because isometric, there's not much motion. So that's the other exercise. You're going to do this 5 or 6 times, again with a 5-second hold. Okay, the other one, if you're having trouble with this, is you're going to do a little bit of a crunch. You're going to hold this up on this side, and then you're going to crunch, climb up, 1, 2, 3, 4, 5, and down. Again, 1, 2, 3. If you have a neck problem, okay, put your hands behind your neck and come on up. Again, come on up, down. Okay. Again, you're going to do 5 or 10 of these. If that is also maybe too painful, you may just want to do a simple foot press. That's where you just take your foot and slowly press down. You're going to come up just a little, but that's all, and relax. Again, and relax. You're going to do 10 of these at a time. So this is a seated correction for the SI. This is a lying correction for the SI. There are seated corrections for the SI also. And that can be done while you're driving. And that's sitting up. All right, I want you to face the camera that way. You're going to put your feet on the floor. This one here, on the pain side, you want to just push your knee forward. Push your knee forward. So what you're doing is just push and hold, 1, 2, 3, 4. So if you're driving, don't do this while you're driving. If you come to a red light, you can put your car in park if you know you got your 30 seconds and do 2 or 3, okay? So never sacrifice the safety of driving to do this exercise. But if you have an opportunity, you're in traffic where you can put the car in park, do that, push the painful side forward. You're gonna see that the other side naturally goes backward. So I hope you find that helpful, and thanks for watching.